I'm concerned about those involved in the CCG having conflicts of interest, such as having shares or business dealings with medical services that they may refer patients to. How can I be confident this does not happen?
I think that one has to look at the statute from the outset, that those who wrote this new law recognised that there would be conflicts of interest. And I would go as far as to say that if we are to do our jobs properly as a CCG, that conflicts of interest are inevitable. The reason for that is that the proportion of the money that we're responsible for in terms of allocating resources is directly influenced by the work that a general practitioner does from day to day, either in his referral patterns or in his access to his or her patients. So it's either through acts of commission or omission. Either way, we influence how much money is spent in the system and where it is spent. And there is no getting away from that. The issue is how we manage it, not whether we can avoid it, because we simply can't. We have to be sure that we use appropriate procurement processes where that's appropriate, and we do. We have to be assured that we use standard NHS contracts for all our contracts, and we do. We have to have in place in-house structures such that conflicts are managed to assure you, the public, that funds are allocated appropriately. And so far we've done this in several ways. First, we have a conflicts of interest register, which all practices are signed up to. This is on the website, and next month in July this conflicts of interest will be revised and will be further extended to assure that all conflicts are fully registered. We are in a position now where those who are clearly conflicted by a particular discussion are excluded from that discussion and from the decision making. We have a lay member for governance, and we have an independent audit committee that oversees all this. This audit committee has lay members and officers of the CCG, but no general practice member sits on that, and that audit committee is governed by our lay member for governance. We are in the process of looking at other means by which we can become more transparent and the issues of conflict can be addressed even further, and I hope to be able, within the next couple of months, to be able to share those with you. But you can be rest assured that this is an issue that we take very seriously, because we know you do. But it is an issue that we simply can't avoid. And if we were to not look at any piece of work that would involve a potential conflict of interest, we'd be completely tied and wouldn't be able to do our job at all.